Mumbai. This is an arm of Apollo Hospitals, Apollo Sugar, which is focusing on diabetes healthcare centers in particular. Joining me now is Sangeeta Reddy, Joint Managing Director, Apollo Hospitals Enterprise, to talk more about this new initiative. Thank you very much for joining us on NDTV Profit. Explain what this initiative really entails.
Very happy to share that Apollo Sugar, which is a specialty clinics for diabetes and metabolic disorders, is launching in Mumbai. So we'll have 4 locations and these are fully equipped with the range of the diagnostic equipments required for early screening of diabetes as well as continuing ongoing screening. We have specialist doctors like Dr. Shashank Joshi, Dr. Shah, as well as 17 other doctors who have joined the team. They'll also be supported by dietitians, physical therapists, counselors, to ensure that the large problem of diabetes, Mumbai, I believe, has 1.1 million diabetics and almost half the number in pre-diabetics. But the sad data about diabetes is also that 70% of diabetics in India today are in non-compliance or poor compliance. So sugar enables a person to stay in compliance and achieve their targets, which is their HbA1c, to achieve those targets in a very well-structured program. So that's what we're launching today.
Indeed, diabetes, a disease that in a sense has silently become one of the largest issues that India has to grapple with. But let's talk about Apollo Hospitals and these new healthcare centers. And, I wanted to get a sense from you on whether a lot of investment is required for this.
No, these are asset-light models, and right now the company is well capitalized. Apollo Sugar is a separate company. We recently had investment from Sanofi into that company. They invested over 90 crores. So we are an asset-light model and we are well capitalized. The plan is to have around 200 clinics around the country in a period of over the next 3 years.
Okay, so pretty rapid growth that you have planned. I want to take a step back and just get your thoughts on the fact that India is falling short on several global benchmarks for healthcare delivery. Now, that must sting, for healthcare delivery models that have been established in India, like Apollo.
So you are absolutely right in that India, in terms of number of beds per population, at 0.9 per thousand is way lower than the WHO standard of 3 or 4 per thousand people of population. So in number of beds, we're extremely short. In terms of doctors, we need to double our doctors, treble our nurses, and increase almost 5-fold our paramedics. There's a tremendous shortage in that area as well. But the good news about the Indian healthcare scenario is, one is that we are capable of doing world-class care at 1/10 of the prices. The outcomes that is being delivered by Indian hospitals and Indian doctors is being acknowledged everywhere over the world. And we're also innovating, like sugar is one of these innovations, where this is a hospital and physician-centric condition management or disease management program, which will, for a simple price, like a 1-year program, including doctor's consultation, lab tests, counseling, the mobile app, SMS reminders, the whole package is under 15,000 rupees for the year. So this is an innovation. I mean, at $200, you wouldn't be able to get anything to cover you. Maybe they'll cover for a week in any other environment. But more importantly, the doctor is in the middle of it. So we are expecting that we will have some really good results in terms of medical compliance, which we've also, in the patients we've treated so far, we presented at the American Diabetic Association and showed that 87% of our patients are reaching compliance, which is a global benchmark. So there's a lot of good things happening in the Indian market. We just need to scale, enhance our numbers, improve the investment, and of course definitely invest in education and quality.
Indeed, there are a lot of good things happening. And, I didn't want to dilute that. But, you talked about the fact that we need to scale, we need to, really boost our numbers. There's one estimate which says to attain a median of 30 beds per 10,000 people, an investment of $230 billion is needed. Is that overestimating?
No, I don't think the estimate has been overlaid, and this is something that the healthcare sector has continuously been requesting the government, is that we need incentives or an impetus to ask people to invest in healthcare. It is not one sector which is normally invested in. We need FIIs, we need local entrepreneurs to invest in healthcare. Right now, what you're seeing is primarily 80% of the investment is coming from small doctors or nursing homes investing into their environments. But this is not creating the large systemic change which is required to really upgrade the Indian health system. You also need a lot of this money to go into primary healthcare, which is one of the most deprived areas. And for that, we need good PPP models with the government. We also need to vision out the combination or the movement to create a continuum of care between primary, secondary and tertiary care. And most importantly, in a country which is plagued with NCDs, and the global impact of NCDs is extremely huge, but in India it's estimated that it will cost over $6 trillion by the year 2030. What we need is a methodology to work with the government, with the primary health care, and create this continuum of care. So it's infrastructure, it's training, it's a quality emphasis, it's an integrated vision so that all players work together. And it's preventive healthcare and screening, which is the most important aspect. We must pick up disease early, and when we find them early, we should ensure compliance and make sure. So that's the whole thing about the sugar clinics, which is we want patients to be able to say, I'm a diabetic, but I'm disease-free. So I'm not suffering because of the disease. I have the disease under control. And that's what sugar is all about.
Indeed. What are your thoughts on how the Indian healthcare system is, and the healthcare delivery market is really poised to benefit from the demographic shift that's anticipated in India?
See, I think even today, if we look at the healthcare industry, with the fact that because we have such a large number of people under the age of 35, it creates an empowered workforce. If you look at it over the next 10 years and expand the segment, because hand in hand with technology, the Internet of Things, connectivity, a young India can potentially take care of a graying world. And so we should look at healthcare beyond the boundaries that we look at it today. And this sector is really poised for tremendous development. But equally, we have to be cognizant of the fact that the number of geriatric patients is increasing, the average life expectancy is increasing, and therefore the healthcare spends are going to keep going up. So people must plan for infrastructure as well as appropriate insurance to ensure that they'll be able to afford care in the later years of life.
For Apollo hospitals in particular, are you looking at a more aggressive pan-India expansion, given that the leadership in the South is firmly established?
So absolutely, we'll continue our expansion across India. We are currently with 4 hospitals coming up. We're adding over 1,400 beds. So this is Navi Mumbai. We have a new facility in Bangalore and Malleshwaram coming up, Vizag, as well as what we've done in Guwahati. So 4 hospitals, one actually literally in every region of this country, and this expansion will continue.
And one final assessment from you on how the pharmacy business is doing?
Absolutely. Absolutely. The team is well poised to continue on their growth path. They're also looking at new formats, more larger formats of pharmacies, a lot more of their own products into the pharmacy. There's a margin enhancement. So multiple good innovations happening in the pharmacy division.
Okay, your phone's ringing, so I'm going to let you attend to that. Sangeeta Reddy, Joint Managing Director, Apollo Hospitals Enterprise. Thank you very much for joining us today.
Thank you. Good talking to you.
Thank you. We're going to take a break now here on the show, and when we return, a quick stock take of how the markets are doing, some individual interesting stocks moving based on news or brokerage calls, a market assessment and wrap coming up after break.